Essentials of Pharmacology for Health Professions, 9th edition, Chapter 14, Cardiovascular System Medication. Please keep in mind this is a summary of the chapter. You will need to review your ebook or book for further knowledge of the chapter. Chapter Objectives. Upon completion of this chapter, the learner should be able to identify the different types of antiarrhythmics, general indications, side effects, and cautions. Classify the most commonly used antihypertensives and their side effects. Describe the different types of coronary vasodilators and their cautions and side effects. Understand the 6 antilipemic categories and describe their actions. Describe antithrombotic agents in terms of administration, action, typical drugs, and antidotes. And explain appropriate and important patient education for all cardiovascular system medications. Cardiovascular system. The cardiovascular system consists of the heart, which is a muscular organ, and a system of vessels called arteries, veins, and capillaries. It plays a very important role. Therefore, it is essential to understand the many medication classes that treat the ailments and conditions of the heart. The cardiovascular system medications are those that affect the heart and blood vessels, as well as anticoagulant and antiplatelet agents that prevent clotting. The following are different categories of cardiac medications: cardiac glycosides, antiarrhythmic agents, antihypertensives, vasodilators, antilipemic agents, anticoagulant, platelet inhibitors, thrombolytics, and hematopoietic agents. This chapter will focus on the antiarrhythmics, antihypertensives, coronary vasodilators, and antilipemic and antithrombotic agents. As a note on cardiac glycosides, these are used primarily for patients with heart failure. The heart fails adequately to pump nutrients and oxygen to body tissues in heart failure. And these agents act by increasing the force of the cardiac contractions without increasing oxygen consumption. Thus, it will increase the cardiac output. Now, digoxin is one of those cardiac glycosides. It's the only clinical drug currently used in the cardiac glycoside family. Cardiac glycosides, as I mentioned, are used primarily in treating heart failure in those patients with symptoms that persist after optimization of treatment with an ACE inhibitor, a beta-adrenergic blocker, and or a diuretic. They can be used alone or in conjunction with other medications, such as your calcium channel blockers, and those are used to slow the ventricular response in patients with atrial fib or flutter. Digoxin is the only one still marketed for clinical use. It can be administered orally and parenterally, and it has an intermediate duration of action. The heart beats by a normal sequence of electrical impulses. When there is any change in this normal sequence, we refer to this as arrhythmia. These electrical impulses can happen too quickly, which is our term tachycardia, too slowly, bradycardia, or erratically, which is fibrillation. Antiarrhythmic agents include a variety of drugs that act in different ways to suppress various types of cardiac arrhythmias. Physicians will select a particular antiarrhythmic agent based on careful assessment of many factors, including the type of arrhythmia, the frequency, and cardiac, renal, or other pathological conditions, along with current signs and symptoms. Proper patient education is important for individuals taking antiarrhythmics. The healthcare professional should inform these patients that lifestyle modifications may need to be done to reduce stress. Mild exercise on a regular basis is helpful, and the patient should rise slowly if getting up from a reclining position. To allow proper absorption, patients should take the medication with a full glass of water on an empty stomach 1 hour before or 2 hours after a meal. And lastly, Patients should be instructed to contact their physician to report any adverse side effects or if they have any questions about the medication. This slide and the next shows the various types of antiarrhythmic medications, their general indication, side effects, and toxicity concerns. Adenosine. It is an injectable medication. It's used to restore normal sinus rhythm in paroxysmal supraventricular tachycardia, or PSVT. Side effects are facial flushing, lightheadedness, headache, dyspnea, and chest pressure. There is no toxicity concern noted. Amiodarone. This is oral and injectable. It's used for treating refractory, life-threatening ventricular arrhythmias. Side effects for this one include pulmonary fibrosis, cardiac arrhythmias, neurotoxicity, visual disturbance, and dermatological reactions. There is a toxicity concern with this one, and it is thyrotoxic and neurotoxic adverse effects in the older population. The next antiarrhythmic medication is beta-adrenergic blockers. And examples of these is propranolol or Inderal. These inhibit adrenergic or sympathetic nerve receptors. It's used in the treatment of hypertension and some forms of chronic angina. Side effects would be hypotension, bradycardia, dizziness, irritability, confusion, hypoglycemia, bronchospasm, and impotence. No toxicity concern noted. And calcium channel blockers. These are used to treat atrial fibrillation or flutter and PSVT. It's also used in treatment of angina and hypertension. Side effects include hypotension, bradycardia, edema, constipation, nausea, and abdominal discomfort. There is no toxicity concern noted. Antiarrhythmic medications continued. Lidocaine. This is a local anesthetic. It's indicated for the second choice for treatment of ventricular arrhythmias. Side effects are usually short in duration. They are dose-related, and they can include central nervous system symptoms, including tremors, seizures, dizziness, confusion, and blurred vision, hypertension, bradycardia, and heart block, and dyspnea, respiratory depression, and arrest. There is no toxicity concern noted. Procainamide. This is orally, primarily as a prophylactic therapy to maintain normal rhythm after conversion by other methods. Potential treatment alternative to amiodarone for the treatment of ventricular tachycardia during cardiopulmonary resuscitation. Side effects include diarrhea, anorexia, nausea and vomiting, abdominal pain, tachycardia, QT prolongation, hypertension, and syncope, dry mouth, blurred vision, confusion, vascular collapse, and respiratory arrest. There is no toxicity concern with this one. Propafenone or Rithmol. This is oral. It's used to treat symptomatic supraventricular arrhythmias or severe life-threatening ventricular arrhythmias. Side effects include dizziness, blurred vision, nausea, vomiting, unusual taste, constipation, angina, heart failure, palpitations, arrhythmia, and dyspnea, fatigue, weakness, headache, and rash. There are no toxicity concerns noted. Now let's check 1. Which antiarrhythmic medication is used to treat atrial fibrillation? Choose from one of the following, write your answer down, and you'll be able to check it at the end of the video. Hypertension or high blood pressure is a widespread epidemic. It affects as many as 1 billion people worldwide and about 65 million adults in the United States. According to the newer American Heart Association and CDC 2020 guidelines, hypertension is defined as regular resting systolic blood pressure of 130 or greater, or diastolic blood pressure of 90 or greater. Because of the strong relationship between blood pressure and the risk of cardiovascular disease, high blood pressure can increase the risk of angina, myocardial infarction, heart failure, stroke, retinopathy, peripheral arterial disease, and kidney disease. Thus, it is very important that aggressive treatment be prescribed for hypertension. Antihypertensive medications are used to control hypertension only, not cure it. After withdrawal from an antihypertensive, an individual's blood pressure will return to levels similar to that before treatment with the medication. Should antihypertensive therapy be discontinued for some reason, it should just be done gradually, not abruptly, because it could cause rebound hypertension. There are 6 classifications of antihypertensives. They are thiazide diuretics, beta-adrenergic and calcium channel blockers, ACE inhibitors, angiotensin receptor blockers, or ARBs, anti-adrenergic agents, and peripheral vasodilators. Side effects of antihypertensives are common. The most common is hypotension, especially postural or orthostatic hypotension, which is when the blood pressure drops from a lying position to sitting up or from sitting to standing. Bradycardia, which is slow heart rate, is another common side effect with many antihypertensives, except with hydralazine, which can cause tachycardia or fast heart rate. Now we'll discuss the 6 different classifications, 3 on this slide and the next 3 on the next slide. Thiazide diuretics. Most patients that meet criteria for drug therapy should be started on thiazide type diuretics, and they can be prescribed either alone or in combination with a drug form from one of the classes, the ACE inhibitors, ARBs, beta blockers, or calcium channel blockers. These are usually effective and have fewer side effects. Also, they're inexpensive. Side effects with the thiazide diuretics include rash or photosensitivity, hypotension, chronic dry cough or nasal congestion. It's resolved by switching to the ARB class, and hypokalemia, which you should monitor the serum potassium levels periodically. The next class is the beta-adrenergic and calcium channel blockers. These, like your thiazide diuretics, are generally well tolerated. They're suitable for initial therapy in some patients with angina following myocardial infarction, ischemic heart disease, heart failure, and certain arrhythmias. Atenolol should not be used to treat hypertension because this drug has no effect in reducing cardiovascular events and mortality. Side effects with these include rash or photosensitivity, hypotension, chronic dry cough or nasal congestion, resolved by switching to ARB class, and hyperkalemia, and you would want to monitor serum potassium levels periodically. The ACE inhibitors, or the calcium channel blockers, Cardizem and Norvasc, these are also initial therapy options, especially for patients with diabetes or high coronary disease risk. The ACE inhibitors, or EIs, is another class of antihypertensives. Lisinopril or enalapril, these act on the lower the blood pressure by decreasing vasoconstriction. They are good choices for patients who also have other serious conditions, those with heart failure following myocardial infarction, when high coronary disease risk exists, diabetes, renal disease, and cerebrovascular disease. Side effects of these are the same as thiazides and beta-adrenergic and calcium channel blockers. The next 3 antihypertensive classifications include angiotensin receptor blockers, or ARBs. Examples of these are losartan or Cozar and valsartan or Diovan. These are similar to your ACE inhibitors, but they're generally used as alternatives. Side effects of these include, relatively they are uncommon with ARBs, but they can include dizziness, orthostatic hypotension, upper respiratory tract infections, and hyperkalemia. Anti-adrenergic agents, examples of these is clonidine or catapress. These are central-acting alpha adrenergic blocking agents. They're mainly used to treat hypertension. They also can be used in various other conditions. Frozazine or minipress, this is a peripheral-acting alpha adrenergic blocker. It's also used mainly to treat hypertension, and it also can be used for other conditions as well. Side effects of these are tachycardia, palpitations, headache and flushing, orthostatic hypotension, and GI effects, including nausea, vomiting, diarrhea, and constipation, and blood abnormalities, edema, and weight gain. The last class is your peripheral vasodilators. An example of this is hydralazine. This is used for treatment of moderate to severe hypertension. Tachycardia are side effects, palpitations, headache and flushing, orthostatic hypotension, and GI effects that include nausea, vomiting, diarrhea, and constipation, and blood abnormalities, edema, and weight gain. This slide shows various mechanisms of action and some examples of drugs that are used to treat hypertension. Knowledge check 2. Which is not considered a classification of an antihypertensive medication? Choose from one of the following, write your answer down, and then you'll be able to check it at the end of the video. This slide discusses coronary vasodilators that are used in the treatment of angina. It's important to note the most common form of angina, which is angina pectoris, which is chest pain, and it results from decreased blood supply to the heart muscle. When there is insufficient blood supply to a part of the heart, this is also known as ischemia, and that result would be acute pain. Vasodilators are administered to dilate or open up the blood vessels and stop those attacks of angina or reduce the frequency of angina when administered prophylactically. The image here, figure 14.3, shows various mechanisms of action and examples of drugs that are used to treat angina. The coronary vasodilators used in the treatment and prophylactic management of angina include your nitrates, beta blockers, and calcium channel blockers. Nitrates are used for relief of acute angina pectoris and for long-term prophylactic management. Side effects can include headache, postural hypotension, blurred vision, dry mouth, and hypersensitivity reactions. Cautions with the nitrates would include glaucoma, intracranial pressure, severe anemia, hypotension, and GI hypermotility. Some examples of nitrates would be your nitroglycerin, and these come in sublingual tabs or spray. These are common ones. There's also other forms that they can come in as well. There are more. There's more information in your ebook or book regarding this. The beta blockers, they decrease the rate and force of contraction of the heart, thereby that reduces the workload and oxygen demand on the heart. Side effects for the beta blockers include headache, postural hypotension, blurred vision, dry mouth, and hypersensitivity reactions. Some cautions with the beta blockers include glaucoma, intracranial pressure, severe anemia, hypotension, and GI hypermotility. Calcium channel blockers, they dilate the arterial smooth muscle, causing vasodilation, thereby decreasing blood pressure and cardiac oxygen demand. Side effects with these include headache, postural hypotension, blurred vision, dry mouth, and hypersensitivity reactions. There's some cautions with the calcium channel blockers as well, and they include glaucoma, intracranial pressure, severe anemia, hypotension, and GI hypermotility. Knowledge check 3. Coronary vasodilators are used to treat blank. Choose from one of the following, write it down, and you'll be able to check your answer at the end of the video. Anti-lipemic agents are used to lower blood cholesterol levels. It's estimated that nearly 50% of Americans have elevated blood cholesterol levels above 200 milligrams per deciliter, which is a key risk factor for coronary heart disease. Coronary heart disease is the leading killer of men and women in the United States, which includes more deaths than cancer, diabetes, accidents, and chronic lung diseases combined. High cholesterol not only can lead to arterial blockage, hardening of the arteries, blood clots, heart attack, or stroke, but may play a role in dementia. Lipoproteins are responsible for transporting cholesterol and other fats through the bloodstream. The following chart shows the three main types and their actions. You have low-density lipoproteins, or LDLs. They're also called bad cholesterol. These carry the largest amount of the cholesterol in the blood. They are responsible for transporting and depositing it into the arterial walls. Very low-density lipoproteins, or VLDLs, triglycerides, which is a source of energy. These are precursors of the LDL and make up the largest proportion of lipids in the diet, adipose tissue, and blood. And then the last one is high-density lipoproteins, or HDLs, which is the good cholesterol. These help transport the LDL cholesterol from walls of the arteries through bloodstream to the liver for excretion. The 6 categories of anti-lipemic agents used to lower blood cholesterol levels and their actions include statins, which are the first choice in managing high cholesterol. They are effective in lowering the LDL levels and are modestly effective in reducing triglyceride levels and increasing HDL levels. Statins are generally well tolerated. Second is the bile acid sequestrants. They bind bile acids in the intestine, interrupt the process by which bile acids are returned to the liver for reuse. Because the bile acids are formed from cholesterol, sequestrants reduce total body cholesterol. They should not be used as a single agent in the presence of elevated triglycerides. Third is the nicotinic acid, or niacin. Nicotinic acid reduces the hepatic synthesis of triglycerides and inhibits the mobilization of free fatty acids from the peripheral tissue. It assists in lowering total and LDL cholesterols and TG levels in the serum. It also raises HDL cholesterol levels. This treatment is generally reserved for patients who cannot tolerate other anti-lipemic drug classes. The last 3 categories of anti-lipemic drugs are the fibric acid derivatives, or fibrates, and they are especially effective in patients who have extremely high triglyceride levels and elevated cholesterol levels, and in patients with combined forms of hyperlipidemia. This form of treatment is a good choice for diabetics because they also improve glucose tolerance. Cholesterol absorption inhibitors. All absorption inhibitors moderately reduce LDL levels by inhibiting intestinal absorption of both dietary and biliary cholesterol, blocking its transport in the small intestine. They can be taken simultaneously with statin medications. And then the omega-3 fatty acids. These assist in the prevention of primary and secondary heart disease and reduce triglycerides. Now let's check 4. Which anti-lipemic agent should not be used as a single agent in the presence of elevated TGs or triglycerides? Choose from the following, write your answer down, and you'll be able to check it at the end of the video. Case study activity. You have a 27-year-old patient who presents for an annual physical and lab draw. Upon review of the patient's cholesterol panel, the physician found normal cholesterol levels but elevated TG or triglyceride levels. Which anti-lipemic drug therapy would the physician recommend? Review the choices, choose the best one, write it down, and the answer will be revealed in the next slide. If you answered D, omega-3 fatty acid, you are correct. Omega-3 fatty acid is one of those anti-lipemic drug medications that can be used and plays a role in reducing triglyceride levels. You get a cut on your finger and it bleeds and bleeds and bleeds. It will not stop. What happens next? Normally, the blood will flow freely through blood vessels and clot if it needs to. Normal hemostasis, or blood coagulation, involves the formation of a fibrin clot or thrombus so that cut will stop bleeding. Should the thrombus not form appropriately, it can be caused by many factors, and that can be vessel wall injury, immobilization, obesity, smoking, medication therapy. These are just to name a few. That inappropriate thrombus formation or clot can dislodge and travel through the bloodstream. That can cause fully or partially obstructed blood flow and therefore leading to tissue damage. And antithrombotic agents will interfere with or prevent thrombosis or blood coagulation. There are three categories of antithrombotic agents that are used, and these are anticoagulants, platelet inhibitors, and thrombolytics. Anticoagulants. They prevent the formation of the fibrin clot by interfering with one of the steps leading to fibrin formation. Common drugs used in this category is warfarin and heparin. How is the warfarin administered? It is oral administration, and heparin is an injectable administration. There are antidotes for both of these. Warfarin is prothrombin complex concentrate or fresh frozen plasma and vitamin K, and heparin, the antidote for that is protamine sulfate. So the purpose of anticoagulant is to prevent the formation of the fibrin clot by interfering with one of the steps leading to fibrin formation. Their purpose is the same, to prevent the formation of clots or decrease the extension of existing clots in such conditions as venous thrombosis, stroke, pulmonary embolism, and coronary artery occlusion. Platelet inhibitors. These interfere with activation pathways to prevent platelet clumping and are given as prophylactic therapy or secondary prevention in patients with a history of recent stroke, myocardial infarction, or established peripheral vascular disease. Common drugs used for the platelet inhibitors are dipridamole, aspirin, and clopidogrel. They're given oral administration, and there are no antidotes noted. Thrombolytics dissolve and liquefy the fibrin of the existing clot. There are two drugs commonly used in this category, and they are retiplase and alteplase. Both of these are administered through IV, and there is no antidote noted. Hematopoiesis is the formation, differentiation, and maturation of blood cells into specific cell lines. The chart below shows the hematopoietic agents discussed in this chapter. All are products of recombinant technology. Erythropoiesis stimulating agents, or ESAs, are responsible for regulation of the production and development of blood cells, normally in the bone marrow. Common drugs that are used in this category are Epitin alpha, or Epigen, or Procrit. They are administered through IV or subcutaneous. Dose will vary. Cautions: you want to use the lowest dose possible to gradually increase the hemoglobin concentration to avoid the need for transfusion. The second one is colony stimulating factors. They are responsible for regulation and production of neutrophils in response to host defense needs. Common drug used here are filgrastim, which is a granulocyte colony stimulating factor, or Neupogen, and pegfilgrastim. This is a long-acting filgrastim, Neulasta. This drug, Filgrastim is administered IV. The subcutaneous dose will vary. Pegfilgrastim is sub-Q, 6 milligrams once per chemotherapy cycle. Cautions with this is patients with sickle cell disorders. Knowledge Check 5. Which represents the most used orally administered anticoagulant drug? Choose from the following options, write your answer down, and you'll be able to check at the end of the video. This is one of 3 slides that provides cardiovascular system medication categories, as we discussed in this chapter, and important patient education. The first 2 are cardiac glycosides and antiarrhythmic agents. Slide 2 contains important patient education on antihypertensives and coronary vasodilators. Slide 3 provides important patient education on antilipemics therapy and anticoagulant therapy. Knowledge Check 6. Which cardiovascular medication system category should avoid contact sports that could cause cuts or bruising? Please choose from the following options, write your answer down, and then you'll be able to check them at the end of the video. Now check your answers. This slide provides knowledge check activity answers for 14.1 through 14.6. It's time to assess yourself. Answer the following questions, write down your answers, and see what you have learned from this chapter. Learning Hints, Clinical Applications, and Patient Education. Please review the helpful learning hints, clinical applications, and read your patient education in the chapters, as these will enhance your knowledge of the different medications. It's also recommended to answer the review questions after each chapter. This concludes Chapter 14, Cardiovascular System Medications.